The suicide rate among veterans under 30 has tripled.
Chronic illness and depression continue to plague America's aging populations.
Increased rates of suicide and violent behavior have been linked to antidepressant medication.
Potential suicide force building lockdown today.
A co-worker stated that the victim had been depressed lately.
She leaves behind a husband and 3 children.
According to close friends, warning signs were there. Warning signs were there.
Each act of suicide intimately affects at least 6 people. It's likely you know someone or know of someone who has thought about, attempted, or committed suicide.
It's been reported more than 38,000 people in the U.S. commit suicide annually, and each year nearly 500,000 more Americans attempt to take their own lives. Sadly, postal workers and their family members are among the statistics.
But suicide is preventable. The United States Postal Service, National Association of Letter Carriers, and America Postal Workers Union are working together to prevent suicides and explain how we can all help in the workplace. Watch the video. Listen to and pay attention to those around you. All of us have a role in preventing suicide.
The connections in our life include family, extended family, and friendships. They exist at work, in our communities, and with our neighbors.
It is important that all of us understand how we can help each other in the workplace. Whether our work relationship is that of coworker, manager, supervisor, or a fellow union brother or sister, we must remember that our work connects us.
Suicide can be a difficult subject to talk about, no matter who you are, a coworker talking to a peer, a manager or a supervisor talking with an employee, or a union steward speaking with a member. But it is a conversation that must happen if someone is thinking about suicide.
We all need to take time to connect when we see a need. There are some obvious reasons why the topic of suicide can be hard to discuss.
It's personal. It's none of my business. I may not know what to say. It can be an uncomfortable conversation to have in any relationship, but it is a conversation that could save a life.
In many situations, a person who is contemplating suicide will give early indications. They may make statements like, "I wish I were dead," or "It isn't worth it anymore," or demonstrate other behaviors that should not be dismissed as meaningless or viewed as just talk. These signals need to be taken seriously.
It may not always be evident that someone is thinking about suicide. If you have concerns, ask. One key is to know the signs. Depressed or sad mood, talking or writing about suicide or death,
Feeling hopeless, helpless, or isolated, mood swings,
alcohol or drug problems, a loss of interest,
withdrawal from others, change in sleep and/or appetite,
personal stress factors such as divorce, financial problems, or job loss, giving away personal possessions.
While someone exhibiting these signs may not actually be considering suicide, these behaviors are red flags that the person may need some help.
Either way, initiating an open, frank, and calm discussion with the individual can open doors and offer hope. You do not need to diagnose or understand the reasons. You can seek assistance from a professional. Don't delay the conversation.
If someone is showing potential signs of suicidal thoughts, one approach is to use a method called QPR. Question, persuade, refer.
Question. Ask the person if they're having thoughts about suicide. Open up a conversation.
Persuade and support the person to seek professional help.
Refer the person to resources for prevention and evaluation. One source is our Employee Assistance Program, EAP. It's free, it's confidential, and it's available to all employees and their eligible family and household members. How to begin the conversation. Find a private location where the person can feel comfortable and safe. Start with a general question such as, I noticed you seemed very upset when you arrived at work today. Are things okay?
Share your concern with the person. I care about you and want to know you are okay. Is there anything I can do? Listen to how the person responds and encourage them to open up and talk.
Be sure not to judge, give ultimatums, or act shocked. Don't give advice or be sworn to secrecy during this conversation. Don't cut the person off or abruptly leave.
Most importantly, take them seriously and let them know you care.
Important. If the person expresses desperation or imminent thoughts of suicide, call 911.
Suicide is a serious problem in our society. As co-workers, we probably spend as much or more time together as we do with our families. This places each of us in a position to potentially save a life.
Connect, know the signs,
Start the conversation, use QPR, question, persuade, and refer.
help the individual get help. Hi, we're the Northland District's Employee Assistance Program. I'm Patricia Randall.
And my name is Joe Boyle. The 1-800 number is answered by customer service representatives in St. Louis, Missouri, which is where the call center is located. They get some demographic information from you, the nature of why you're calling, and then get you connected to one of us. And it could be one of us in a facility, or it could be somebody in a private practice or clinic setting or hospital who's an affiliate.
What if I wanted to bypass the 800 number and just call you directly?
You may do that.
We're available and easy to see. Joe and I can usually arrange appointments within 24 to 48 hours, which is pretty unheard of. So, if you're in crisis, we're available, and even if you're not, we're available.